Now, it is my honor to introduce our keynote speaker, who comes by way of the Office of Juvenile Justice and Delinquency Prevention, a true partner in the prevention of child sexual abuse. Catherine Pierce is a senior advisor to the administrator of OJJDP. In her capacity as senior advisor, Ms. Pierce staffed the Attorney General's National Task Force on Children Exposed to Violence, and recently assisted the Attorney General's Advisory Committee on American Indian and Alaska Native children exposed to violence. Furthermore, she leads OJJDP's policy work on children exposed to violence, girls in the juvenile justice system, and juvenile justice system reform. Prior to coming to OJJDP, Ms. Pierce was the acting director of the Department of Justice's Office on Violence Against Women, where she served as deputy director and oversaw the development and implementation of more than 20 grant programs created by the Violence Against Women Act, and where she initiated a comprehensive effort to measure the effectiveness of those grant programs. She has previously served in the Department of Justice as a civilian member of the Defense Task Force on Domestic Violence, and before joining the Department of Justice, Ms. Pierce directed Summer of Safety, which is a predecessor to AmeriCorps, and has previously served as a deputy at the State Justice Institute, where she developed and managed its judicial educational program. She's done a lot more, but I think that is enough to give you a flavor of the stature of our keynote speaker. Please give a warm welcome to Ms. Catherine Pierce.
Let me get situated here a minute.
Do you have notes?
No, I don't have PowerPoint. Let's see. Good morning, everybody. Good morning. It is my distinct pleasure to speak on behalf of my office, the Office of Juvenile Justice and Delinquency Prevention's Administrator, Robert Listenby, who regrets that he couldn't be here today and who sends his deepest appreciation for the work that all of you do on behalf of our nation's most vulnerable people, our children. Before I get started, I wanted to take a moment to recognize one of our sister offices at the department, the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking, or SMART. And we are really pleased to be able to partner with SMART and proud to follow their lead on many of these issues. I believe some of the SMART office colleagues are here today. Thank you. Hi. Terrific. Thank you for what you're doing. And I also see friends from the National Sexual Violence Resource Center and others of you, and I'm so pleased to be here with this group of people. And as Bob has asked me to do, I thank you for what you do. This morning, I'm going to focus my remarks on children and youth with sexual behavior problems. And I'm going to talk about our work at OJJDP to help those young people and their child victims. I'll touch on three major points. One, the scope of the issue of youth with sexual behavior problems is significant, and the response to date has fallen short. Two, my office, the Office of Juvenile Justice and Delinquency Prevention, is committed to the health and safety of all children, including youth with sexual behavior problems and their child victims. Three, as we strive to address this issue, it is vital that we use treatment approaches that are appropriate for children and youth, approaches and treatment that are very different from those we use with adult sex offenders. So, first let's look at the scope of the issue. The difficult truth is that these are not 1 in a million occurrences. They happen every day all over the country. In fact, according to the National Center on the Sexual Behavior of Youth, more than 1/3 of sexual offenses against child victims are committed by other children, other youth. Of these cases, family members victimize a full 1/4 of these child victims. And despite popular opinion to the contrary, as I know you know, evidence shows that few sexual offenses of children and youth involve strangers. While the problem of youth with sexual behavior issues is significant, the response has been limited thus far. Despite an increase in awareness of the issue during the 90s, the results of existing treatment programs have been uneven. For instance, many of the programs were derived directly from the adult treatment models we know are not effective in treating children and young people. But there are bright spots. In one study that followed youth with sexual behavior problems for 10 years, researchers found that short-term focused cognitive behavioral therapy for children and their caregivers worked. Impressively, the children who received this intervention had future sex offense rates that were so low that they were indistinguishable from the comparison group, who had committed no sexual offenses during their youth or childhood. As many of you know, cognitive behavioral therapy seeks to help change thinking by practicing opportunities to engage in pro-social skills and behaviors. It is a treatment approach that has proven time and again to work with children who have experienced trauma, and the evidence shows that it also works for children with sexual behavior problems. This is great news, and it shows that children and youth with sexual behavior problems who receive appropriate evidence-based treatment or evidence-informed treatment can have extremely low recidivism rates and highly positive life outcomes. In short, children with sexual behavior problems are not destined to grow up to become adult sex offenders. We can change their trajectory and we can change their outcomes. While striving to rehabilitate children with sexual behavior problems, we must also acknowledge the link between victimization and offending. That is why early effective intervention is critical. A recent study published in the Journal of the American Medical Association specifically looked at whether childhood sexual abuse predicts subsequent sexual offending. The researchers found that children with histories of abuse and neglect were at increased risk for being arrested for sex crimes. However, they also found that individuals with a history of child sexual abuse were not at unique risk to be arrested for a sex crime compared with other physically abused or neglected individuals or matched control individuals. Put more simply, all children who are abused and neglected face increased risk of committing future crimes, including sex crimes, and all those children should receive appropriate intervention. However, children who are the victims of sexual abuse do not face uniquely higher risks of becoming sexual predators and should not be stigmatized and restricted as they have been in the past. Certainly, the last thing any one of us wants to do is re-traumatize a child, especially a child who has had crimes committed against him or her. This brings me to my second point. My office's OJJDP's commitment to the health and safety of all children, including youth with sexual behavior problems and their child victims. I'm proud to say that our office promotes both programs and research to assist both of these overlooked and underserved populations. For instance, we are currently funding a program that includes support for project sites as well as training and technical assistance. The program features funding and includes one tribal site. And because of its dual focus on addressing and reducing victimization and problematic behavior, the program has enormous potential. At each of the sites, multidisciplinary teams, which I'm sure most of you are familiar with, will develop community-based integrated services for youth with sexual behavior problems, their victims, and their families. Ultimately, the program aims to develop approaches that will help families and professionals recognize and respond to sexual behavior problems, rather than deny and minimize them. Early, effective, coordinated services will mean more and better treatment options. The program also includes an evaluation component so that OJJDP can measure the effectiveness of the project sites and determines if this approach should be replicated in other communities. I want to especially highlight the tribal site that is part of this program. This site will look at specific ways to meet the unique needs of American Indian and Alaska Native children, and it will develop and implement a comprehensive, culturally relevant Indigenous intervention model that includes mental health, public awareness, and outreach components. OJJDP has also funded significant research that is relevant to this area, including work led by Johns Hopkins-owned Elizabeth Letourneau, the director of the Moore Center for the Prevention of Child Abuse. Dr. Letourneau has directed important investigations for OJJDP on juvenile sex offender management and the impact of offender registries. And most recently, OJJDP has supported her to investigate the impact of safe harbor laws on commercial sexual exploitation of children. Over the years, Dr. Letourneau's efforts have been critical in helping to ensure that our laws and policies are based on objective findings from research, and we thank her. OJJDP also funded the first ever comprehensive national survey of children exposed to violence, or NATSEV as we like to call it. The NATSEV prompted the establishment of the department's Defending Childhood initiative, which aims to better respond to the pervasive problem of trauma caused by children's exposure to violence. The NATSEV found that 60% of all American children have witnessed or experienced some form of violence in their homes, schools, or communities. In response to those findings, Attorney General Eric Holder appointed a task force of 13 individuals, chaired by Joe Torre and my boss, Bob Listenby, I should say, which held hearings around the country to learn more about the problem. In December of 2012, the task force released a final report with over 50 recommendations. Part of the report, thanks to some of the people in this room, specifically addresses the trauma that sexual abuse causes. It pointed out that sexual abuse, in particular, places children at high risk for chronic life challenges, including health problems, substance abuse, and mental health issues. As a response to what we learned from the task force, and to share what we continue to learn, we are now supporting the development of the National Center on the National Center on the Sexual Behavior of Youth website. When it is fully launched, the website will include valuable sections for parents, youth, and professionals. This effort to inform the public and promote awareness is central to our work. Through making the public aware, we can ensure that youth with sexual behavior problems receive adequate services and fair treatment. When it comes to promoting awareness, one of our most important jobs is to ensure that there is not just understanding of the issue, but also appreciation of how best to treat it. That is my final point today. It is vital that we use treatment approaches that are appropriate for youth, approaches which are very different from those used with adult sex offenders. First, any effort to treat youth with sexual behavior problems must be based on the well-documented fact that juvenile sex offenders have more in common with other youth in the juvenile justice system than they do with adult sex offenders. That is why treatment based on adult models have been largely unsuccessful. Any treatment used with youth must be developmentally appropriate and take into consideration the unique aspects of youthful offenders, including, and this is very important, potential previous victimization, inherent impulsivity, and their incredible capacity for rehabilitation. This philosophy is in keeping with OJJDP's larger focus on a developmental approach of juvenile justice reform. In 2012, again, the National Academy of Sciences released a groundbreaking report on advances in neuroscience research as they relate to juvenile justice reform. The National Academy's report showed that as many of you know, teenagers are different from adults. I mean that literally. Children and adolescents are biologically wired differently than adults. They have trouble regulating their feelings, have a heightened sensitivity to peer pressure, and don't fully understand the implications of their decisions or actions. Therefore, in the juvenile justice system and elsewhere, children and youth must be treated differently from adults. OJJDP is looking at how to use the knowledge that the National Academy report to lead reform efforts, and the Academy has also funded a follow-up report that includes practical information about how to implement this reform at the federal level. But we need your help. We need the help of practitioners and others on the front line to make comprehensive reform effective, to make it work. Especially when we are dealing with the tough issues that I'm talking about today. It is imperative that we work together to hold youth accountable for their actions, prevent further offending, and treat them fairly. At OJJDP, all of our efforts to help young people are based first and foremost on the fact that these youth are still children. They deserve treatment, evidence-based, developmentally appropriate, trauma-informed treatment. Most importantly, they deserve a chance to reclaim their childhoods and become vital members of their families and their communities. Elsie Boudreau, who is an Alaska Native and a very strong, wise, and passionate advocate for children who've suffered from sexual abuse, testified before the Attorney General's Task Force on Children Exposed to Violence at their hearing in Albuquerque. I'd like to leave you with a brief quote from her testimony. "We must acknowledge that we are all related. When one child is hurt, we all hurt. And the opposite is true as well. When one child is protected and loved, put in a place of honor, we all benefit. Let us continue to work together to give all of our children a chance. Let us help all of our children reclaim their childhood. Let us take Elsie's advice with us in the work that we do every day. Thank you again for what you do. Thank you for listening. Thank you for having me. And thank you for being such extraordinary, powerful advocates."